Hi, this is Dr. Reynaldo O. Joson, Director of ROJoson PEP-TALK. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. What I have in mind in my pep talk, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as a priority. This is my key performance indicator. I hope you will be in my group of 30. I launched this pep talk on May 15, 2021 with module on COVID-19. Second module was on patient empowerment. Third module, patient management process. Fourth module, rights in patient empowerment. The fifth module, staying healthy and contented. There are 5 parts in this module: introduction and intentional living plan, healthy lifestyle plan, screening and periodic health check, early diagnosis and treatment, first aid and basic medical care. My pep talk today is entitled Staying Healthy and Contented, Screening and Periodic Health Check. My empowerment objective is for lay people to have an understanding of the use of screening and periodic health check as a strategy in staying healthy and contented. We have heard of various terms such as executive checkups, annual physical examinations, screening, surveillance, periodic health exam, periodic health check, etc. All of them have one thing in common in terms of purpose: looking for a disease that may be present in apparently healthy and asymptomatic persons. Let me try to dissect and collate the various terms. Screening is the most encompassing term that signifies an action to try to detect potential health disorders or diseases in people who are apparently healthy and who do not have any symptoms of a disease. The goal of the screening is early detection of diseases so that they can be treated also early enough to avoid disability and death. Screening can be done only once, meaning on a one-time basis. It may also be done repeatedly, as in periodically, every so often, the periodicity of which may be determined based on the risk factors of the patient, such as occupation, age, family history, etc., the recommendation of the organizations, and/or the wish of the patients. The annual physical examination, popularly known as APE, that is popularly being used in the workplaces and schools, is an example of periodic screening. Other screening programs that are being done periodically are the so-called executive checkups and cancer screening packages. Executive checkup is a health screening program, originally or historically speaking, being done for executives or people with senior managerial responsibility in business organizations. The phrase is still very popular up to these days, even if the screening program has been extended to just anybody, the common people in the community. Hospitals and clinics still use the term executive checkup to market their health screening programs. There are different packages of executive checkups. Cancer screening packages are those screening programs being recommended by different medical organizations and governments intended for the early detection of different types of cancer. Examples are screening packages for breast cancers, colorectal cancers, prostatic cancers, cervical cancers, etc. Periodic health check and periodic health examination are terms that have started to be commonly used in the medical world to refer to periodic screening instead of the traditional executive checkups and annual physical examinations. These terms encompass all past and current screening health programs such as the executive checkups, annual physical examinations, cancer screening, and others. Except for the newborn screening program, in the Philippines, all existing screening programs are not mandated by law. Again, except for occupational, travel, and organizational requirements, subjecting oneself to a screening program is voluntary. There may be recommendations from medical organizations and governmental health ministries and peddling by hospitals and clinics, but the decision rests on the individual persons. Medical surveillance, how does it differ from medical screening or screening? Screening can be up-leveled to a medical surveillance where the connotation is that there is a need for close monitoring with screening or periodic screening. Medical surveillance is usually done in the following situations. After something unusual is found on screening and there is a need to closely observe or monitor the findings in order to get to a more definite diagnosis. After a definite medical condition is found on screening, and there is a need to closely observe or monitor it, as it does not require an active treatment at the moment, the so-called expectant management or watch and wait approach or management. After a treatment of a definite medical condition or disease has been done, regardless of whether this medical condition or disease was found on screening or not, and there is a need to closely observe and monitor for persistence or recurrence of the medical condition or disease. Example, medical surveillance for cancer recurrence after treatment of a certain cancer. How does the World Health Organization define screening? The World Health Organization in 1994 defined screening as the use of presumptive methods to detect and recognize health risks or asymptomatic disease in apparently healthy individuals in order to permit prevention and timely intervention. Screening is performed to categorize members of the general public into those with higher or lower probability of disease, with the former group being urged to seek further medical attention for definitive diagnosis and treatment. Should I have a periodic health check or periodic health examination? The answer is yes and no, after removing the legal, occupational, travel, and organizational requirements. The answer is yes if you and your trusted physician have assessed that you, generally healthy, have a higher risk for developing a particular disease because of a strong family history. Some would use age as an indication if there is a high incidence for a particular disease in a certain age group. You should undergo screening. If you should undergo screening, screen only for identified disease at risk. The answer is no if you or your trusted physician have assessed that you, generally healthy, do not have a higher risk for developing a particular disease as compared to the general population in your age group. Other reasons for no answers. Studies have shown that general or routine health checks have not reduced morbidity or mortality, neither overall nor for cardiovascular or cancer causes. Practical recommendation is to be selective using risk-based approach. Just like in curative medicine, the biggest pitfall in disease prevention, which screening is a strategy, is that things that ought to work do not always do so. Even the strategy of screening had its failures. The presence of false positive results in the screening test has many asymptomatic patients wrongly labeled as being ill. Instead of improving the quality of life of people, this phenomenon of false labeling has been found to wreak havoc on the social, psychological, physical, and financial stability of unfortunate individuals. Furthermore, false positive tests often lead to a battery of expensive and unnecessary follow-up procedures. The presence of false negative results can give a false assurance that everything is okay, which may lead people to ignore or minimize new symptoms. A lot of times, pounds of prevention translate to just an ounce of cure. If you don't go for periodic health checks and periodic health examination, make sure to listen to and watch your body closely for symptoms of a particular disease. Once symptoms of a particular disease occur, consult a physician right away. With this strategy, you still have an opportunity to catch the disease early. So should I have a periodic check or periodic health examination? Not always. There is another option of promoting early diagnosis aside from periodic health check, the so-called symptom-based early health check. I will be discussing symptom-based early health check in the next session under diagnosis and treatment. For the moment, let's just focus on screening and periodic health check. So again, it is used for people who are asymptomatic, apparently healthy, who are screened for early detection of diseases so that they can be treated early enough to avoid disability and death. I will elaborate on the general methods, specific methods, tests, and utility. I may make comments on advantages and disadvantages. There are some myths on screening and periodic health check. Screening and periodic health check must always be done with laboratory tests and x-rays. No, not true. They can be done without laboratory tests and x-rays such as physical examination and risk assessment interview. The other myth is that screening and periodic health check done with laboratory tests and x-rays are always conclusive and always more accurate than without tests. No, not true. There are also false positive and false negative with laboratory tests and x-rays. Thus, they are not always more accurate. Here are listed the general screening methods which are commonly used. Without use of gadgets, just relying on risk assessment interview and physical examination. Without the use of gadgets, just relying on physical examination. Without use of gadgets, just relying on risk assessment interview and no physical examination. With the use of gadget, with risk assessment interview and physical examination. With use of gadgets, without risk assessment interview and physical examination. Gadgets here means instruments used on top of inspection and palpation of the physical examination, such as thermometer, blood pressure apparatus, stethoscope, otoscope, nasopharyngoscope, ophthalmoscope, endoscopy, blood examination, imaging procedures such as ultrasound, X-rays, CT scan, MRI, nuclear scan, etc. Risk assessment interview means asking the patient or the person to explore for possible presence of significant risk factors for a particular condition, medical condition, or disease. Physical examination means examination such as inspection and palpation of the body of a patient or person using the 5 senses of the physician and without the use of gadgets. So without use of gadgets, just risk assessment interview and physical examination. So using this one and this one. Without use of gadgets, just physical examination. Example here is the annual PE, physical examination in schools without laboratory test. Without use of gadgets, just risk assessment interview and no physical examination. So this can be done, but not as effective as with physical examination. An example of this one is that you get the history of a close contact with a COVID-19 patients. Therefore, you have a high risk for COVID infection asymptomatic. Comparing the three, the effectiveness of these three methods without the use of gadgets, the best still will be that with risk assessment, interview, and physical examination, because physical examination can explore and investigate risk assessed in the interview. An example of a risk assessment interview and physical examination, its usefulness. So, example, risk assessment interview reveals positive significant risk for breast cancer in a 50-year-old female. So when doing the physical examination, the physician will allot more time and effort on the breast for possible breast cancer. Another example, after the risk assessment interview, it was found that there is a positive significant risk for stroke in a 60-year-old male. So when doing the physical examination, the physician will allot more time and effort on the neurologic examination of the heart rhythm, etc. As to the screening methods using the gadgets, comparing the two methods, the effectiveness, risk assessment interview and physical examination with screening gadgets is better because the findings of interview and physical examination can be correlated with those on gadgets to reduce the problems of false positive and false negative conclusions. And comparing the cost effectiveness of the two methods, gadgets with risk assessment interview and physical examination is better, as the latter will rationalize the use of the former, meaning using gadgets, okay, without physical examination and interview, okay. So the screen, okay, so it means it will be the examination, the screening gadgets will be done only when indicated. So here are examples of the commonly used screening gadgets. Thermometer is being used to monitor the screen for temperature, blood pressure apparatus, blood pressure, weighing scale, the weight, stethoscope, the heartbeat and the breathing, the otoscope, ear, nasopharyngoscope to examine the nose and throat, ophthalmoscope, eyes, blood examination, examination of the blood contents, urinalysis, urine, endoscopy, and imaging procedure. Any part of the body can be scoped or be imaged by X-rays. So this can be done once or repeatedly as indicated. Example of use of thermometer as a screening tool. Screening for possible COVID-19 infection during the pandemic. Okay, if the presence of fever, suspect COVID-19 infection. There are false positive, so not all fever are COVID-19. There are also false negative, not all COVID-19 patients present with fever. Example of blood pressure apparatus as a screening tool. This is used for screening for possible hypertension, persistently elevated blood pressure above normal. Hypertension should be suspected. Weighing scale as a screening tool, screening for underweight, overweight, and obesity. Complete blood count, screening for blood disorders. So it may detect anemia, leukemia, and thrombocytopenia. Urinalysis as a screening tool, screening for urinary infection and kidney disease. Chest X-ray, screening for pulmonary tuberculosis. Screening methods for diabetes. The following can be used: risk assessment interview, okay, looking for higher risk if with family history of diabetes. The gadgets of screening that can be used: fasting blood or plasma glucose test or FBS, fasting blood sugar, or HG1AC. Screening methods for hypercholesterolemia, okay. Risk assessment interview. There's a higher risk if with family history of hypercholesterolemia, and then the gadget screening tool can be a lipid panel. Screening methods for breast cancer, risk assessment interview. There's a higher risk if with family history of breast cancer. Okay. So the other tools that can be used will be breast self-examination, physical breast examination by the physician, by the specialist, and mammography. Screening method for colorectal cancer, risk assessment interview, higher risk if with family history of colorectal cancer, rectal examination, fecal occult blood test, or fecal immunochemical test, or FIT, and colonoscopy are examples of screening methods. Screening methods for prostatic cancer, risk assessment interview, higher risk if with family history of prostatic cancer, rectal examination, examination for PSA, a blood test, prostatic surface antigen, or other screening methods for prostatic cancer. Screening methods for cervical cancer, risk assessment interview, higher risk if with family history of cervical cancer, pap smear and HPV, or human papillovirus tests, can be done. Screening methods for lung cancer, risk assessment interview, higher risk if with family history of lung cancer. Okay. Screening methods using gadgets can be low-dose CT scan or X-ray. So there you are, screening and periodic health check. I have given you examples of screening methods using different approaches: risk assessment interview, physical examination, and use of gadgets. Periodic health check means the screening is done from time to time at certain intervals, regularly or not regularly, meaning as needed. In this era of commercialism in medicine and healthcare, where there are a lot of hospitals and laboratories, clinics, peddling screening packages, one should understand the indications and pros and cons of screening and periodic health check. Don't be swayed easily by the marketing and discount offers, like those shown here. The most cost-effective indication is still to have screening and periodic health check if there is a high risk for a certain disease. The other indication is to do screening and periodic health check, especially using expensive gadgets, only if there is a good chance for curative treatment of the discovered disease. Another advice is to look at the scientific data on cost effectiveness of screening and periodic health check. These are some of the good sources of information: the US Preventive Service Task Force and the Canadian Task Force on Preventive Health Care. Here are some examples of the importance of illustrating the importance of studying the scientific data. Okay. Complete blood count is considered to be one of the most abused blood tests because, based on the findings, okay, neither CBC nor its components should be ordered for screening asymptomatic non-pregnant adults, as it does not reduce mortality. Up to 11% of results are abnormal, but less than 1% of results require management change. Another example, urinalysis, or another commonly abused test being done left and right. Urinalysis is not recommended except routinely, except in pregnant women. As for lipid panel, okay, most of the time we have lipid panel being ordered yearly, left and right. Okay, so the recommendation is not, it should not be done every year. Okay, reasonable options for screening interval include every 5 years, screening at 5 years for low-risk people who have had low or repeatedly normal lipid profiles. Breast cancer screening, again, we have mammography being done left and right, but note the age here as recommended by the Canadian Task Force on Preventive Health. In women aged 40 to 49 years, mammography is not recommended. In women aged 50 to 74 years old, mammography every 2 to 3 years is recommended. MRI, computed tomography, ultrasound scans are not recommended for screening. So, to repeat, in this era of commercialism in medicine and healthcare, where there are a lot of hospitals and laboratory clinics peddling screening packages, one should understand the indications, the pros and cons of this screening and periodic health check. Not be swayed easily by the marketing and discount offer by these clinics and hospitals. So takeaway in this pep talk, screening and periodic health check is used for people who are asymptomatic, apparently healthy, who are screened for early detection of diseases so that they can be treated early enough to avoid disability and death. Should I have a periodic health check? The answer is yes and no. Yes, if you and your trusted physician have assessed that you, generally healthy, have a higher risk for developing a particular disease because of a strong family history. If you should undergo screening, screen only for the identified disease at risk. The answer can be no. If you and your trusted physician have assessed that you, generally healthy, do not have a higher risk for developing a particular disease as compared to the general population in your age group. If you don't go for a periodic health checks and periodic health examinations, make sure to listen to and watch your body closely for symptoms of a particular disease. Once symptoms of a particular disease occur, consult a physician right away. Symptom-based early health check means that at the onset of symptoms, a patient consults a physician right away for early diagnosis so that a discovered disease can be treated early enough to avoid disability and death. And symptom-based early health check also carries an opportunity to catch the disease early. The thing that has to be emphasized also, if an early stage disease is diagnosed, whether from periodic health check or from symptom-based early health check, this should be followed by early treatment to get good results. A late treatment by the patient for whatever reasons will negate the gain of early diagnosis. So with that, I end my pep talk. Staying healthy and contented, screening and periodic health check. I hope I have empowered you to have a better understanding on the use of screening and periodic health check as a strategy in staying healthy and contented. Thank you for your kind attention. Goodbye, mabuhay kayong lahat.